We are now heading from the small intestine to the large intestine. The excitement is just overwhelming. So here we go. So now remember, most absorption and digestion have occurred in the small intestine, so what's left is what has not. Yep, let's get this going. Okay, so most of the time the ileocecal sphincter, which is that sphincter between the ileum of the small intestine and the first section, the cecum, of the large intestine, is closed. So what causes it to relax? Enhanced activities of the stomach initiates what's called the gastroileal reflex, which is going to enhance the forced segmentation of the ileum. So the ileum, so it's kind of like a food in, food out. So food goes in your stomach, that kind of initiates this reflex. You get segmentation, which is basically peristalsis of the ileum. And then you have gastrin, which, remember, when things enter the stomach, gastrin is secreted, relaxes that sphincter, so what's ever left at the end of the small intestine then starts heading into the large intestine / colon. Now, most of you have probably heard of this, the microbiome. Your large intestine basically has more bacteria and some viruses and fungi, which are not bad for you, than number of cells that are in your body. So the microbiome, more bacteria are located in your large intestine than you have cells, human cells, in your whole body. So there are lots of them. So 10 million types of bacteria within the large intestine. One of the side effects of antibiotics is when you take antibiotics, you are destroying bacteria. What can happen is not only can you destroy the bad ones that may be making you sick, you can also destroy the good ones. And so you can get severe diarrhea and some other issues with that. We'll talk about that more when we get into the immune system. The role of the appendix. The appendix is what's called the vestigial organ, which means you don't need it. But one of the advantages of it, what they think happens, is that it can actually supply your large intestine with its microbiome. So let's say in the case of you're taking antibiotics and you're losing some diversity of bacteria in your large intestine, the appendix can supply your large intestine with some of your microbiome. So it may play a role, even though you can live without it. So what happens in the large intestine? Some water is absorbed. So you do get absorption of some water. What's left in the large intestine is called your feces. Okay. Peristaltic waves are going to move the feces along. So it comes from the ileum. Whatever's left, bacteria will start to digest whatever's left. You'll get absorption of some water. You'll also get absorption of some vitamins. And then peristalsis will be moving it along, the ascending through the transverse, descending, sigmoid colon, rectum, and anus. Mass movements are when you get large waves of peristalsis that travel over a larger area. Again, this is a reflex action, so when you consume food, you eat, you might find this in the morning, when you eat food, again, stomach, it causes small intestine to move things into your large intestine. It also causes things to move out of the large intestine, which pretty much the way out of your large intestine is out your anus. So you get these mass movements. So you get these mass movements that you can sometimes feel, and then boom, you got to poop. Okay, you got to poop. Now, what are farts? Farts, the technical word is flatus. And when these bacteria are working on whatever's left from the small intestine, what is they start to digest things. So like beans, you don't digest beans very well. So a lot of the bean particles, bean parts, are still left in your large intestine. These bacteria can work on it. Well, just like you, when bacteria eat, they make waste products. And the waste products of these bacteria is this gas. And so you got millions of bacteria making this gas, then you make gas, and then that's what you pass on as farts. All right, I took this picture when I was in Africa that one time. So you're probably thinking, my God, she's amazing. She can catch poop coming out of an elephant. I actually was waiting for it to poop, and it did, so I got lucky. All right, so when mass movements occur, it pushes feces against the rectal wall, and this causes what is called the defecation reflex. Now, you have two, remember I told you at the beginning of these videos, if you get mad at someone, call them an anal sphincter? Okay, this is why. So you have two anal sphincters. You have an internal anal sphincter and an external anal sphincter. The internal anal sphincter is smooth muscle. You do not have control of it. Okay, you do not have control of it. It's smooth muscle. So when the feces hits that, when you have these mass movements, these peristalsis that's happening, and your poopy hits it, okay, you can't really control that. So it will relax, and that kind of gives you the feeling of, ooh, I gotta poop. Okay, I gotta poop. Now, unlike peeing, which you can kind of control and say, no, I don't want to pee right now, with defecation, you don't have that much control. Luckily, you have an external anal sphincter, which is under conscious control, and this is a skeletal muscle. So the poop hits the internal anal sphincter, which relaxes, and you have no control of that. But then you have this external anal sphincter that you have control of. That is skeletal muscle. So what happens with children when they're being potty trained is they are learning to control that external anal sphincter. So I went through this, and I must have said in class, you know, thank God for external anal sphincters because you have control of them. So one class, and this is probably 20 years ago, a class of mine actually bought me a t-shirt, which I still have, but I can't wear it many places, but it says, thank God for external anal sphincters. Okay, so these are the ones you have control of. So you feel like you have to poop, you've got control, hopefully you can hold that little sphincter tight, and then when you get to the toilet, basically what happens is you're consciously releasing that external anal sphincter, and out comes the poop. Okay, out comes the poop. Okay, so if you're ever in aerobics class or anywhere where you need to fart and you want to try to get away with it, here are some ways to do that. You can flap your arms vigorously, you can blame it on somebody else, or you could rapidly vacate the area, usually the whole room, and that will work. Okay, so that's basically, we've now removed the poop, okay? The poop has been removed. So I want to go over a couple disorders with you, especially the first one, because we'll come back to it when we talk about the urinary system. I want to talk about diabetes. So we're going back now to the ability to control and maintain homeostasis of your blood sugar. Okay. So there's two types of diabetes. There's actually another type called diabetes mellitus, which has more to do with something else, but we'll come back to that with the urinary system. So you probably heard of someone who's diabetic. There are two types of diabetes. There's type 1 and type 2. All right, with type 2 diabetics, they don't secrete insulin. Now remember what I told you insulin does. Insulin allows sugar that's in the blood to get into the muscles and into the liver. Okay, so it lowers your blood sugar. It lowers your blood sugar. Okay. With a type 1 person, they do not make insulin. They are usually diagnosed when they are younger, and what happens in some people, and we don't know exactly why, is their immune system actually attacks the cells that make insulin, so they lack the ability to secrete insulin. So it usually happens in people that are younger. Not always. There are cases when people are not diagnosed with type 1 diabetes till they're adults, but usually it is in younger people. And again, their immune system has attacked their pancreas. So what happens is they don't have the ability to bring their blood sugar down. So it keeps going up, 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 and up. And remember, I've told you a few times that when your blood sugar goes too high, it can be very hard on your bloodstream, on your blood vessels, it can be very hard on your nervous system, and that is not a good thing. So they don't have the ability to keep their blood sugar from going up. Symptoms, they can be very, very tired, which I know sounds strange because they have all this sugar, but they can't get it where they need it, okay? So their muscles are not getting the energy they need and so on. They urinate a lot, which we'll talk about that when we get to the urinary system. They're very thirsty. They get a sweet smell to their breath. They always tend to be hungry, and when they finally are diagnosed, sometimes they can go into a coma because their blood sugar levels go so high that their blood sugar levels, when you take it, normal is going to be anywhere from 110 maybe to 60 or 70. Their levels can be 700, 800, 900, 1,000. Okay, sometimes they can go into a coma. That's a lot of times what it takes to diagnose it, because again, their other symptoms may go unnoticed for a while until you know what you're looking for. So how do you control? Well, they have to do what the body cannot. They have to inject insulin. They have to replace the insulin that their body is not making. They use it with genetic engineering. They've actually put the insulin gene, the human insulin gene, into bacteria, and the bacteria will make it. But they have to control their blood sugar as best they can. And they do this with a very restrictive diet. So their diet has to be very controlled. How much sugar they take in, how much protein and so on has to be controlled. They have to moderate their exercise. They have to moderate when they're injecting the insulin. They have to keep track of their blood sugar, which can be very difficult. It's becoming a little bit easier that they can wear what's called a pump. And what the pump will do, it will monitor their blood sugar throughout the day, and then it will inject small amounts of insulin during the day to try to keep their blood sugar where it needs to be. The problem is that it's very difficult to do this. Stress can change it. If they go exercise, they have to moderate their blood sugar. They may have to consume more sugar. They may have to give themselves more insulin. When they give themselves insulin, they have to make sure they eat so it doesn't go too low. It is not an easy lifestyle to lead, and many young people have difficulties with it because they can't lead a very normal life in terms of the things they want to do. So what are the health risks with being diabetic? Well, obviously you have the issue that if your blood sugar goes too high or too low, which it can do, and even with a type 1 diabetic, the brain can start to suffer. They're more prone to heart disease. They have circulation issues if they can't monitor and keep their blood sugar where it needs to be. Glaucoma, which is an eye issue. They can lose their vision. They can lose sensation in their nerve endings, so in their feet and hands especially, because again, if they've not been able to control their blood sugar over a lifetime, it can start to wear away at the nervous system. It can lead to, and it many times does, it leads to amputation. They get an infection in their foot, and they don't know that it's infected because they can't feel it. And since their blood supply tends to not work as well, they can't get white blood cells to an area, so they get infection. That infection starts to go up their leg. The only way they can stop it many times is to amputate that leg. They also have kidney problems. So there's lots of issues that go with being a lifetime diabetic. They don't have much control. They don't have any control over getting it or not. The only control they can develop is the ability to monitor their blood sugar over a lifetime. But it is very difficult. Now, type 2 diabetes is different in the sense that people do make insulin with type 2 diabetes. They just become insensitive to it. Their body does not respond as well to the insulin. Now, this is more of a lifestyle thing. People that tend to not eat well, who don't exercise, who may be overweight, they are more likely to become type 2 diabetics. So they have insulin, they make it, but it does not work as well. So they secrete the insulin, so their blood sugar levels won't be as high as a type 1 diabetic, but they will still run too high. So a fasting glucose of over 100 or 110 starts to get you towards becoming a type 2 diabetic. So they are not able to monitor their blood sugar naturally as well as they should. There are medications that can help their body with this process, but it still can lead to health issues. It can lead to the same health issues as type 2 diabetics, okay, or type 1 diabetics. Again, one of the signs of a type 2 diabetic is that their fasting blood sugar or fasting glucose. Fasting means they haven't eaten in a while, at least I think 10 hours. So if they haven't eaten in 10 hours and their blood sugar is still too high, that can be a sign of type 2 diabetes. Again, there may be no symptoms. This is actually what they consider an now obviously we called it this before COVID, but this is kind of like an epidemic. It's running all over the place, but we don't know it. So there are a lot of people who are type 2 diabetics and don't know it. They don't know it. Some can control it with oral doses of medication. Some, by losing weight and eating better and exercising, can actually kind of reverse it. So they're not a diabetic, but they can use oral doses of medication. They can take medications that help them use their sugar better, that help them use their insulin better. They can start exercising, eating right, losing weight. All of those things can help control type 2 diabetes. But the risk factors in terms of diseases are the same as type 1. And so if we have a large population of people who have this, it's going to cause health issues down the road. Now, it used to be that you never saw a young person become a type 2 diabetic. Type 2 diabetes was usually in the adult population, usually older, 30s, 40s, 50s, not that 30s old, but 30s, 40s, 50s, and older. we are now seeing children in their teens who are type 2 diabetics. So the reason for this is because the increase in obesity, lack of exercise, not eating correctly. The scary thing is that if we see more and more kids that are type 2 diabetics, they're going to live a longer life with diabetes. They're not going to live a longer life. They're going to live a longer time with having diabetes. And so we're going to see issues in the next 30 years that if we have kids in their teens that are type 2 diabetics trying to live 20, 30, 40 years being a diabetic, and we're going to see some health issues with that and some long-term healthcare issues with that. So again, we're seeing more children that are becoming type 2 diabetics. We've never seen that before in the past. Okay, we've never seen that before in the past. So that's going to become an issue. Okay. All right, so that's diabetes. I want to bring those up. All right, understanding it's a lack of ability to maintain homeostasis of blood sugar, because we are going to talk about it again when we get to the urinary system. This is kind of an icky picture. So if you don't want to see it, I don't know, turn away. Okay, so this is what happens with people, and I know this looks like their toes on backwards, and I don't understand that, but they've had a toe amputated, and you'll see here they have a pretty severe infection. Again, because they can't feel it, the infection can go on for a time period before they know it, and then they don't have the blood supply because, again, damage to blood vessels. They don't have the blood supply to bring the immune system in to get rid of the infection. So sometimes, to keep it from spreading, they will just amputate. Okay, they will just amputate. I've worked a little bit a long time ago with diabetics, type 1 diabetics, who wanted to exercise. And it's very good for them to exercise, but you really have to monitor their feet. Because if you think about it, you know, you get a blister or something on your foot, you feel it and you do something about it. They may not feel it, so they have to have very good socks, very good shoes, and every night they have to do a foot inspection. They have to check their foot and make sure there are no cuts on it, nothing that can get infected, because again, they may not feel it. Okay, they may not feel it, and that can cause problems. Okay, we're not going to do that. All right, so that is the end of digestion. Okay, that is the end of digestion. There's going to be 1 or 2 more videos on metabolism. But again, check your objectives to make sure that you've got everything you need from this video. The end.